So before we get into today's material, I just want to talk about ways we can better learn. Um, I think before the end of class, just come up to me and grab me. I want to make sure I get you for attendance. Um, I think last time we talked, there were a handful of people that in their first, maybe second semesters of college. Maybe there was a long time since the last time they were a student themselves. So I'm going to give you some tips on just how to be a better student. Now, there's a couple things that I will tell you on how to get a good grade, right? That's the outcome we're looking for is get a good grade. Because if you get good grades, then you get into the PTA program and then you get to tackle your life from there. So how we get good grades depends on a few factors. Some of them you control, some of them you don't. So some of those factors are you interested in the class? How many people have to take a class they just don't want to take, but it's part of the requirements, and you have to say, okay, I'll go take that class. What classes are they for you? They're different for everybody. What about you, TJ? The math class, math. Yeah, everybody's like, yeah, math, yeah. Anyway, well, we just got to count to 10 over and over again in the PT world. What other classes? I had somebody in the last group say developmental psych they had no interest in, but they psychology. Yeah. What else? Anything else? So a class you're not interested in, harder to get a good grade in. Yeah. Um, there's some classes, even if you're interested in them, they're just hard classes. I think anatomy is a hard class. I think anatomy, week one of anatomy is here's, 30 things you got to learn. And then what's week two? Here's 30 new things you got to learn. What's week three? Here's 30 more things you got to learn. What do you think week four is about? Another 30 things. So I don't think anatomy's all that complicated, but there's a lot. There's just the volume. So that's going to be a hard class, even if you like it or don't like it, right? It's just a hard class for everybody. Um, One of the factors that you don't control is the talent of your instructor. Pretty lucky in this class for this one. How many people have taken a class with it? Make sure I grab your name before you go, okay? How many of you have taken a class with a professor you just didn't click with? I had one professor, this was in grad school, and it was his last semester before he retired. That guy, great guy, one of my favorite people, did not learn a thing from it. He had his feet up and it was just, you're not doing that. So, I mean, there's some talent in the instructor that you hope to get, but you're not in control of that, right? So do you like the class? Is the instructor good? How easy or hard is the class? I think this one, some people find it challenging, other people find it easy. I think our Com 100, is that one of your classes? Com 100, Com 101, something like that. It's a writing and speaking class. Some people find that really hard, other people find it really easy, right? So there's some variation between you as a learner. Um, Here's the thing, you need to get good grades to get into the PTA program. I think next week we'll talk about the PTA program and how to get into it, what it takes. But there's three classes you have to get either an A or a B in all three of these classes. This class right here, your was it Rehab 1010, the med term course? And that's just a 1 credit course, right? But it's self-paced. I think that makes the class harder. Self-paced all online, to me, that makes it harder because it's easy to not work hard at it this week. It's also you don't have a teacher to say, "Hey, I just don't get this." Like you've got to go out of your way to do that, right? So I think that class is sneaky in its difficulty level. The other class you got to get a good grade is anatomy. That's going to be tough for everybody to get a good grade in. So those are three classes you need to get an A or a B in. All three. Rest of them you want to get good grades, but if you got one, if the math class you don't like, you got a B minus. Hey, fine, you'll live, right? But these three classes you got to get B or above those three. I'll talk about more why later. So here's the thing: it's your job to get the grade. It's actually not your professor's job to even teach you well. I mean, scary to think, but the responsibility is on you. Here at CCRI, we have all the resources we could possibly need to enable as much success as possible. I think the tutoring center is fantastic. Anytime I've had a student go there, they say it's worthwhile, so they can help you in some ways. We'll talk about that later. But I think some of the other challenges, either you don't know how you like to learn. How many people just are sitting here going, I don't know what the best way to learn is? How many people know, hey, if I do this, I like to make charts. Here's my list, here's my chart. If I learn that chart, I'm good to go. Does anybody know, how many people know they're flashcard learners? If they make flashcards, they're good. What about how many people are just like textbook learners and say, if I read the textbook over again, I'll be good? I don't get a lot of those. How about auditory? So just like, hey, sit back, let me just listen. That's actually how I went through college. Just to sit back. I'm not taking notes. I'm just going to listen. How many people are that way? Just like to listen. How about visual, where you have to see me, you have to see me do it. You can't just learn about it. You got to see me do it. Yeah. How about the reading when we already talked about? Kinesthetic is more hands-on. I can't read a textbook. Just give me the person and I'll work on that person. Yeah. How many people, those people like anatomy lab way better than anatomy lecture? How many people here like the lab portion? Here's the model. Here's put together the skeleton. That's way better than most people think. Here's the problem in PT and other rehabs, we need a mix of all learning styles. You have to pass written exams. You have to be able to read and write with our patients. I think most of us are the kinesthetic learner. We're pulled towards this profession because overall we are kinesthetic learners and we want to be moving. So what I will tell you is your studying methods should reflect how you learn best. So here's what I call this the study cycle. Now I didn't make this up. This is something well researched. I wish I could take credit for it, but I can't. But here's the big 5 steps to getting a good grade. First step is preview the material before you learn it. Told you last week, it's a lot like trying to watch a movie without watching the trailer first. You're lost for the first 30 minutes. This guy is zombie. Is he a killer? Oh, no, wait, it's a comedy. I don't even know what's happening here. So preview beforehand. I'll dive into that a little bit. Your biggest rep is attending class. So you guys are here. Great. I tip my hat to you. Like I said last week, night classes are tough. You guys, for the most parts, have full-time jobs, families, other demands that are pulling you away. It's tough to show up with energy, show up ready to learn. That's not easy to do on these night classes. So I tip my hat. But attending class is your number one rep that you can get. Next up, reviewing after class. I'll talk about that a little bit more. Active studying. Research says 1 hour blocks are the best. Beyond that, you get too fatigued to actually make a difference in your life, in your learning. I have some logistics problems with that. I have some students that can only study 3 hours on Sundays because they're busy from 6 a.m. to 8 p.m. every single day of the week, and they can't fit in an hour of studying a day. So I'll talk about some of that too. There's difference between active and passive studying. I'll talk about that too. And then to assess your learning, we got a couple ways we could do that. So preview, does anybody have any textbook on them? It doesn't have to be the one for this class. Does anybody have any textbook on them? You do? Yeah, can I see it? So I think I don't love the textbook we have for this class. Thank you. But again, I'm showing you this stuff to apply it to all of your courses, not just this one. If I only cared about this course, I'd just talk about this course and say, well, I taught you everything. In order to get into the PTA program, you need to succeed in all of your classes. So I hope you can apply this. I actually hope you can apply this to the classes you don't like. So previewing, I like doing it with textbooks. For my materials, I actually think just looking at the learning objectives and glancing at the PowerPoints is it. But all it is, if on the syllabus you're going to cover, okay, next week we'll cover chapter 3. here's my preview. I'm going to open up to chapter 3. Perfect. All right. Who's got the time? Somebody glance at the time. All right. So 5:43. So I'm just going to glance at the chapter here, chapter outline, kind of look at it. History, education, utilization, characteristics. Oh, that might be interesting. Characteristics of PTAs, APTA, and oh, Josh talked about that last week. Trend summary. All right, not bad. Some key terms. I don't see any terms that I don't think is too complicated here. All right, the textbook's got some learning objectives too. Hey, this is a big box. Definition of PTA. Man, if that interests me, I might actually just read that. Might not, right? It's just a preview. I don't have to dive into it. You can see big chart here growing over time. Yeah, pretty cool. I like to read all of these like bold headings. Purpose of PTA education, accreditation. All right. Ooh, what did I say? I'm a chart guy. So this chart, I would say, ooh, there's a chart. Let me look what that means. I dislike these. Yeah, these are like decision trees. If this, then that, then that, then that, then that. And you go like, so I don't really like those algorithms. So I'm probably just going to skip that on my preview because I don't like it already. Some models, okay. Nothing. Delegation, direction, and supervision. Okay, kind of cool. Hey, those look pretty cool. Somebody on a treadmill with a harness. That's called a goniometer. That's pretty cool. Levels of supervision. All right, competence. Considerations. Oh, another one of those algorithms. Continued competence. Okay. Demographics. Hey, women. 75% of PTAs are women. All right. Evolution. PTA caucus. Honors awards. Special interest groups. Out PTA team. And then some case studies at the end. What time is it? 5:45. So that took 2 minutes. Pretty short chapter. I think in some classes your chapters are probably longer, right? So, yeah, 5-ish minutes. Does anybody have 5-ish minutes? Yeah. So what did I just do? So now when I start talking about all of those things in the chapter, you've already just got a little preview. You know kind of what I'm about to talk about. So that to me is as quick as it has to be. For your more challenging classes, you need to do a little bit more. For your classes where the professor's not as talented or detailed or just tired, you're probably going to have to do a little bit more. For the classes you just struggle in and just can't get it, probably going to have to do a little bit more. But I think if you just did that, you're showing up today ready to learn. Now, the other thing we can do is, I'll show you with this. So initial pass, that should be brief. That's what I just said. Second pass, if, again, depending on all the factors I keep talking about, you might want to do it one more time. And in that one more time, you might start saying, okay, I'm going to come up with my list of questions that I have. For me, that any word that's a heading becomes a question. I'll show you what that means in a minute. Third pass, if needed, then I'm going to try to answer those questions. I think that might be, the research says that's what you should be doing. I think that might be asking a little much. Again, depending on all of your factors, you decide that. So if I do that second pass, when I go back through my notes, any bold word I'm going to turn into. So this is a page out of the pathophysiology books that I use to teach in a different course. You don't need to know any of this information. Don't worry about it. But if the chapter is brain disorders, my preview is I do my first pass, just exactly what I did, 2 minutes. Anything cool, I stopped. Anything else, I just get a general idea. My next pass is I'm going to come up with my questions that I need to answer. Any bold word, I turn to question. What is dementia, non-Alzheimer's, including Lewy bodies, senile dementia, or vascular? What is the etiology? What are the signs and symptoms? What is the prognosis? What are medical interventions? What are PT interventions? So my second pass, I just write that list in this section. 6 questions I write. For me, that's probably where I stop. Not a great instructor, class you struggle with, but class you really need to get a good grade in. Your third pass, you go and read the chapter and answer those questions. I think you can answer those questions when you come into class. If you come into class with the chapter outlined like that, guess what you get to do in class? Pay attention. And when I talk, I will answer those questions, most likely. If I say we're going to cover chapter 3, I'm probably going to answer the questions that you just wrote in chapter 3. Now, this is something that always happened to me. You guys are probably not. I would show up in class, but then I would daydream. Anybody sit in class and all of a sudden you snap to them like, oh my God, where are we? Like, what do we just, I just missed class for the last 25 minutes. Yeah, I see some, yes, right? Man, if I've got my list of questions I'm listening for, now I'm not a passive recipient in the class. Now I'm an active participant. And if you can say, hey, Josh, you talked about dementia. Are you going to talk about non-Alzheimer's dementia, or are you just going to talk about Alzheimer's? Then I might say, yeah, you know what? Non-Alzheimer's dementia is important, but I just want to focus on Alzheimer's for this class. Great. Now you're an active participant. Now you're engaged. There's less opportunity to start dreaming about which superhero would I be? Like that was one of my favorite daydreams when I was in class. That's what I think about when I'm still talking. I'm talking up here thinking about, no, not Batman. He gets into too many fights. I don't know. So now with that, man, how long do you think? So our first pass was roughly 2 minutes. Second pass, how much time do you think that would take you to go through the chapter, just pull out the bold words and make him a question? Depends on the textbook, 15-ish, man, for just about 20 minutes, now you're ready to go in class. Again, you guys have to figure out what's right for you. Now, attending class is the most important thing you can do. I like to say some classes are high rep classes, some rep classes are low rep classes. Attending class is your number 1 rep. Now, if you have your preview ready to go, I'll show you what I think is good for us. Actually, I'll just tell you. Second slide of every PowerPoint will be your learning objectives. I think instead of looking at the textbook, you make those learning objectives your questions. There you go. So if you're ready to go, man, ask questions to clarify. I don't understand morbidity versus mortality. I don't understand what direct supervision versus general supervision. Can you explain it to me in a different way? I can try, right? You clarify your information, confusing information. Here's the other thing. Pay attention to instructors' tips. Who's the person you want to play poker against? Anybody here play cards? Anybody here play poker? Who's the person you want to, if they have a what? If they have a tell. Do you guys know what a tell is? That's when somebody picks up their cards and they're really, really good. They go, whoa! You go, all right, I'm not going to bet on this. He's got good hands. So every single one of your instructors wants you to succeed. Some because it's just easier to pass somebody than to fail somebody. I want you to succeed because I want you in my profession that I love so much. You guys are great people. You give me great energy when you show up here. If you pay attention to me, I tell you exactly what's going to be on the written exam if you're listening right. But do you guys ever you write notes, and all of a sudden you look up and I'm 3 slides down and you're still trying to write notes on the first slide? Anybody fall behind like that? In all that time that you missed me saying, this is going to show up on the exam. Say it directly, but I make it obvious. So do all of your professors. So when you are well prepared, you get to stay on task, you get to keep up better, and you get to pick up on all of those. Oh shit, better start this. That's what usually that's my tell. Have I said that last? Underline this, highlight this. Yeah, that's one of my tells. That's a pretty direct one. Anyway, that's another good reason to show up prepared is because you get to pull in. Actually, I had a student. I record lectures for some of my other classes. I had one student come to me and he goes, "I know what's on the exam, Josh." I go, "Oh yeah." He goes, "Yeah, I watched your video about 10 times over the weekend, and you make it pretty obvious what you think is important." So, hey, great. Hey, you watched the video 10 times. That's great. Like, good studying. Um. So now the next thing, review after class. How many people have greater than 20-minute ride home? 20 minutes or more. How many people are 10 minutes or less? Few of you. So you guys might have to take the long way home. The review after class could be as simple as on your ride home. Think back to the learning objectives. Which one can I remember that I thought was pretty easy? Which one do I think was pretty tough? Sometimes they're tough because they're complicated, or maybe there's a word you don't understand. Sometimes they're tough because they're just big and you go, God, I got to know a lot of information for this one thing. So, sometimes that review after class, it can be done just on the ride home. So instead of turning on Taylor Swift and rocking out, think about class just for a few minutes. Why did you give me that smirk after I said to listen? Grades aren't in yet. You wait to bust her chops until after grades are done. Then you can be free. You don't want that hanging over your head. The other way to do it is to rewrite your notes, translate into that your own words. That's another step. It's a little bit more labor intensive, but again, that depends on your learning styles. Active study, again, 1 hour block is what research says is the best. Sometimes it's not logistically appropriate. But here's the thing: how come we're all here at 5:30? Showed up at 5:30, ready to go. How come? Because what? It's the schedule. It's in the schedule. We put it in our phones. If work calls us and says, "Hey, can you work on Wednesday at 5:30?" Your answer is, "Oh, I'm busy. I got something to do." Do the same thing for your studying. Studying is one of those things that you say, "Oh, I've got to study," but then study time comes and your buddy calls you and say, "Hey, can you play basketball?" And you say, "Yeah, I can." And then you go to study and go, yeah, but the dishes are in the side. Let me go do the dishes. And then all of a sudden you say, I got to chop firewood before it's going to be so cold. And the studying never actually happens. Did anybody fall into that trap? That happens to me all the time. Schedule yourself your study time. For this class, for your other classes, that's the way to keep yourself honest. That's the way to say, I can't work Tuesday mornings because I'm studying. Now, anybody know the math? How much time you should be studying outside of time for in class time? General rule of thumb is you should be studying between 2 and 3 hours per 1 hour in time class. So this is a 2 hour a week class. That means you should be studying 4 to 6 hours a week for this class. So full-time college student is considered 12 credits, right? So a credit is generally 1 hour of class time. So 12 credits means 12 hours of class a week. Generally, the labs get a little wonky with that. Anatomy lab might be 4 hours, but only counts for 1 credit. That gets a little weird. So who wants to do math for me? If you're taking 10 credits, I mean, it's how many hours a week should you be studying outside? Who's taking the math? Who said they didn't like math? Who wants to do 20 to 30 hours? If you're taking 10 credits, that's not full time. 10 credits means you should be studying 20 to 30 hours a week and then in class another 10 hours a week. That's why 12 credits is considered full time. It's because you should be spending 12 hours in class and then 24 to 30 something hours outside of class. How many of you have 20 hours a week to study? I, I haven't met a CCRI student that actually can make that work. Families work, rents due. I got to make money because rents do. Electricity, you can't buy eggs for less than $7. Like there's real logistics that. So how do we make this efficient? 1 hour blocks is most beneficial. Start with the most difficult information. Don't start on learning objective number 1 or slide number 1. What is the most challenging thing I need to know from what we learned last week? That's what your job to start with. Because if you're going to study for an hour, when are you at your best and when are you at your worst? Best in the beginning. And then after time, less and less and less, right? So start with the most difficult stuff. Don't leave the challenging stuff to the end when you're already tired. Leave the abbreviations for the end. Those are easy. Yeah. Here's what I think can get us closer to that time. I think we do have 20 hours a week to study. If we were to grab the data from your phones, how many people spend 20 hours a week on TikTok, Instagram, X, Facebook, YouTube? How many people it's not all day, it's not 8 hours on a Sunday you're on YouTube, right? But I'm waiting at the coffee shop. Let me pull up Instagram. I'm waiting for my oil to change. I'll scroll through Reddit for 20 minutes. I think we do have some of that time. Maybe not 20 hours a week, but some of it. I bet you we do. So when you're studying, if you can create passive study material in that time, what that means is who likes flashcards? Some people do. So creation of flashcards with your active studying. Now, guess what you get to do? It's hold yourself accountable by not looking at TikTok. Does TikTok still work? I forget. What is it? Is that back on? I can't keep up with it. Yeah, hold yourself accountable. Take your flashcards out instead of your phone. But that's the way we get closer in a realistic way on getting to the study time. What are some other ways you guys like to study? Quizlet. I think Quizlet's pretty nice. Oh yeah, it used to be better. Oh really? Oh, that sucks.
Towards the end of my senior like, and like 20 something, like a good amount of money for it to work.
Oh, that's no good. Yeah. Yeah. What are some other ways you guys like to study? Nobody knows. Reread the notes. Yep. What do you? Yeah. Anybody use ChatGPT or other AI to help study? How many of your professors have scared you from using that at all? I think if you cut and paste the learning objectives into ChatGPT and said, give me some study questions, it'll do a good job. It's a way to use ChatGPT to help your learning. You got to make sure you learn the material. It's your job to learn material, but yeah, I think that's an easy way to use that. So I think creation of those passive study materials. Who's got greater than 30-minute commute every day? I do. So the challenge for us with the longer commutes, and I think some of us with just more frequent, shorter trips too, how can we study while we're driving? Is playing the video recording as we're driving and not watching the video, just listening, is that enough? Do you record yourself with a voice memo or something else on your phone that you get to listen to? Do you read your flashcards out loud as you're driving? And now that's something you can quiz yourself back and forth for. Like that's the challenge. There is a way to get to that 20 to 30 hours a week. It's just not always locked in the library for 30 hours. So flashcards, other travel tasks that you can come up with. Some students like to make dances. I think that works well with anatomy. There's a couple things. If you look up like myotome and dermatome dance, that's a big one. I'm not. I'm a great dancer. Don't get me wrong. I'm not a great dancing to learner though. That's the part that I don't do. Flashcard people, there's a handful of them. Here's a tip for you. Make both sides of the flashcard a question. There's something about asking and then answering a question that helps cement memory faster. So if you make both sides a question, you're always asking yourself a question, and you are cementing the memory faster. But also, you just doubled the amount of flashcards you have just by making it into a question. So think about that. After that, assessing your learning. I think you go back to my learning objectives, and can you answer each learning objective as you just quiz yourself? To me, for this class, that's the number one thing. Not all professors are as crystal clear as I try to be. There should be at the end of each chapter case studies, practice questions. There's always something. If you do pay for Quizlet, there might be some other people that created it. ChatGPT, like I just said, or other AI can help you with that. So assess your learning and say, oh, geez, I still am not getting these things right. Why not? Then you go focus on that. So that's all I want to say for now. All right. Do we have any questions about test taking tips or anything else? Does that spur any ideas for you guys on ways you can study? Hopefully. All right, licensure and liability. Here's our learning objectives. We'll come back to those in a little bit. Do you guys want to shut this light off? Is it? Can we flip one? I forget which one it is. Yeah, that helps to see, right? All right, so roles of PT versus PTA. Both of us have to practice with each person's scope of practice. The scope of practice is influenced by federal laws, state laws. State laws, the collective group for state laws is called the Practice Act. How many times did we mention that last week? Few. Well, we already, this is slide number one, and we already mentioned it again. What does that mean if I keep mentioning a term over and over again? Yeah, we better learn it. Yeah, what was your question?
Do all the states have the same scope of practice?
No, there's a lot of similarities between scope of practice state to state, but no, there are differences. So yeah, we would have to know it. So scope of practice is influenced by laws, but also has professional guidance and personal abilities. So it is legal for me to, I talked about this last time, to breed a wound with sharps. That means to clear out dead tissue out of a wound with things like scalpels and tweezers. It is legal in Rhode Island for me to do that. I have never done that before. I've never taken a course in it before. I've never practiced it. I've never been mentored how to do it. If I were to do it tomorrow, I would be practicing outside of my scope of practice. Not because it's illegal for me to do it, it's because I'm no good at it. So I need to have the ability to do it. So just because you can do it legally doesn't mean that you're good enough to do it within your own ability. So PTs are responsible for doing evaluations of every single kind. PTAs can execute treatments within their scope of practice. Dry needling is a little bit like acupuncture if you haven't seen it before. Wound debridement with sharps, manipulations, spinal manipulations, all outside of the scope of PT practice. PTs can do it, but outside of the scope of PTA practice. So we've talked about this a lot last week. Who wants to give me just a quick little definition in one word? What's examination and who does it?
Yeah.
PT does it, yep. And what is in the examination for the patient? You can give me a summary about what that is. Perfect way to put it. Initial data collection. How strong are they? How tall are they? How much pain do they have? How long has this problem been happening for? Any medical history that we need to know about, any medications, every single piece of information under the sun that we might think is important would would get collected in the examination. Evaluation. Who does it and who can give me a description about what it is? First of all, who does it? PT. And what is it? It's a little abstract.
More data collection, what can the person do, what are the limitations?
Not necessarily. So we already collected the data in examinations. Yeah, what do you got? So that's more information that we would need in the examination. The evaluation is putting all of that data and figuring out how important it all is. So who is the actor we used in our example last week? So Ben Affleck, right? So he had a shoulder injury. Is that what we gave him? Ben Affleck having a shoulder injury is way different than if I have a shoulder injury, right? How old is Ben Affleck? Late 40s, 50-ish. So I'm 40. So he and I are in the same age group. But it doesn't matter if we're the same injury. Our lives are incredibly different. And the importance of all of the examination data is going to change everything else. It's going to change our prognosis, our treatments, and all of that. So that's what the evaluation is. It's figuring out the importance of all of this data. Examination, I liken it to dumping out pieces of the jigsaw puzzle. Get all your edges over here. Here's all the red pieces. Here's all the blues. Here's all the greens. Like, it's just data that you're just dumping out on the table. The evaluation is putting the puzzle together to actually see a picture, if that makes sense at all. Diagnosis, PT diagnosis. So who comes up with it? PT and who can, it's kind of a weird one. Who can we talk? It's the consequences of the condition, not necessarily the condition itself, but the consequences of it, the physical consequences. Prognosis is a lot more important. So who gets to come up with the prognosis? PT. And who can talk to me about what's in the prognosis? There's three major elements. The plan of care, that's probably the most important thing that we do. There's two other elements. What do you got?
How long?
How long? So how much time is it going to take for this person? And then what's one other? How good are they going to get? What is the outcome we're expecting here? Yep. Now, in that plan of care, there are also goals, short-term goals and long-term goals. There's also exact treatments that we want to do strengthening for this, do stretching for this, do balance activities for that, add this modality for pain relief, anything and all the treatment parameters we might want to do. And then who gets to do intervention? Both PTs and PTAs, absolutely. And if we execute all of this well, we get good outcomes. I talked about three major outcomes that we're hoping for our patients. Anybody remember what those were? One was return to, so improving current level of function. That's one we're going to do, yes. And there was one we hope most of our patients, this is what our next biggest goal is what? Return to prior level of function. Yeah, not all of our patients will. Some conditions are progressive conditions, which means they're going to get worse over time. Parkinson's is an easy example of that most of us are familiar with. But yeah, I worked with a patient this morning. 2 months ago, she fell walking her dog, broke her hip. She drove herself independently before she fell. She had fractured hip surgery, nothing major. We better get back to driving soon. That's a heck of a lot different than if she fell, broke her hip, and got a brain injury. and now she has trouble with speed of processing information. I'm not sure that person's going to get back to driving again, because what do you need to drive? Process a bunch of information quickly. So that's how the prior level function, we don't always get to that, but definitely improve current level function. And there was one other major goal. What was the other one? So improve current level function, definitely. Prove return to prior level function, hopefully. And then one other one is a definite one. Prevent future consequences. So for this lady that I worked with before, what do you think that I really have to work on? Yeah, I'm gonna get her back in and out of the car. I'm gonna get her back walking. I'm gonna get her up and down stairs. But what's the major thing I have to prevent for her? Another fall. Another fall. Yeah, don't fall again. Did you have something else?
What if it's like something that like I can't think of the example.
Well, I mean, so if we had if my patient got hit by lightning and I had to fix all of that, yeah, maybe I'd say don't hold that umbrella when it's lightning out next time. Yeah. But prevention of future consequences, if I'm playing basketball and somebody undercuts me and I fall and I hurt my arm, all right, but I can't control somebody undercutting me, right? Um, but what I might have to say is, listen, because you had this fracture, this structure is going to be weak for a while. You're back to your prior level of function. You're back to playing basketball, but here's what you need to do to make sure it stays strong and it gets even stronger from here. But there's also there's opportunities for us to impact patients' health beyond just the condition we're talking about. I've talked to plenty of patients. I had one patient, this was last summer. I was seeing him, great guy, but he weighed around 350 pounds and he really needed a knee replacement. No doc is going to give him a knee replacement at 350. So worked with him with the problem he had was knee pain. And I got him back in and out of the house like he wanted to get. Like I met all my goals. Before I left, the conversation was, have you thought about trying to lose some weight? Because if you can get to under 300 pounds, you might have a shot at this joint replacement. Have you ever thought about that? Because what's going to happen if you're 350 pounds eventually? There's other health concerns there. And guess what? It's my job as a physical therapist to open that conversation, hopefully in a loving, kind, supportive way, and not, I don't want to, sometimes late in the day, my filter of what not to say. So I'm glad I caught it there. Especially because I'm recording myself. Joshua, do you say this? Hopefully I can do it in a kind, loving way and a supportive way and not an accusatory, negative way. But yeah, I think that's part of my responsibility as a healthcare professional to open the door on these conversations. And you know what? And that guy, I was in his home twice a week for 2 months. He and I got to know each other pretty well. If he called me tomorrow, I'd be excited to talk to him again because he was also just a good guy. Yeah, I think that's part of it. So it's not always just about the condition, although sometimes it is. Like the lady I'm talking about, had that fall. So, all right, good. So we went through this stuff. So some factors that influence sharing a patient with a PTA. So first off, federal regulations. There's some federal regulations that might block it. The State Practice Act is another one that we have to consider. Practice setting can sometimes be it. The big ones for me, patient complexity and PTA experience, or to me, that's the biggest reasons for it. There are plenty of patients. So I was thinking about this. I chose not to share a patient a few months ago with my PTA that I work with is phenomenal. I chose not to share a patient with her because the guy was 6'6" In his medical history, he also was bipolar and schizophrenic, and he told me that he doesn't take medication. He doesn't take the medication he was prescribed for. And my PTA is a 5'1" female. There's something in my nicest guy, super sweet guy, worked with him for months, had never had an issue. But there was something in my gut that just said, I don't know if this is the right one. There's a big size difference. There's a mystery over here I'm not quite sure about. I'm going to keep this one. There are some patients that are really complicated and need constant PT reevaluation. I will also say PTA experience is another one. My PTA is phenomenal. I give her patients that I don't know what's going on. I did an evaluation recently. I called my PTA up after I was done. I said, listen, I did the best I could. I really don't know what's going on here. Here's where I think we're going in the direction of. If you think I missed anything, let me know. Because I think she's phenomenal. So if my PTA didn't have that level of experience and I didn't trust her and she wasn't as good, I probably would have kept that patient because this patient's really complicated. I don't really know what's happening here, you know. So those things can influence us. There are sometimes some reimbursement. Reimbursement is a fancy insurance word for payment. Some insurances will pay, I'm making up numbers here, but $50 for a PT treatment and only $40 for a PTA to treat that patient. So there can be some consideration for that. But so collaboration of the PTA and PTA, I text my PTA all the time. She and I communicate all the time. Just checking in, everything going well, yeah. PTAs can execute the interventions, but communication is crucial. One, when things are going well. More importantly, when things aren't going well or when new problems arise. If I do an evaluation for somebody because they're a baseball pitcher and they have a hurt elbow, great, go work with the PTA. I'll see you, and I'll see you in a few weeks. If that athlete comes in with a sprained ankle, all right, elbow's doing fine. We got a new ankle problem. What needs to happen there? We need a new evaluation because that problem didn't exist before. PTA cannot treat the ankle part because they haven't been evaluated yet. So that's where it gets a little bit tricky. So that's what we mean by when new problems arise. At minimum, PTAs have to practice with what's called general supervision. General supervision is defined where the PT is available via telecommunications during all treatment. So just a phone call. I just have to have my phone on. Anytime the PTA is working with my patients, my phone has to be on. I can go on vacation. I gotta have my phone on. I don't think that's much of vacation, but I could. I could also say, hey, I'm going on vacation. Scott, our other PT, is around. Call him. He knows. I briefed him on the 3 patients you're seeing. Call him if there's any problems. And then Scott gets to take on that responsibility as a PT. General supervision also means that there has to be a documented supervisory visit every 14 days, and the patient has to be reevaluated every month or 10th treatment, whichever comes first. Additional communication, anytime the patient needs a reevaluation, sometimes the patients progress really quickly. Josh, you thought this person would get better in 4 weeks. It's week 2 and they're already meeting their goals. Great. Maybe they're ready for discharge. Lack of progress. Man, we've been treating this patient for 2 weeks. They've been at 7 out of 10 pain every single time. It's not changing. All right, well, things should have started happening now. I wouldn't expect miracles, but should be closer to 5. Why is this not happening? So lack of progress, new problem like we talked about with the ankle. So anytime it's in the best interest, when in doubt, talk it out. Talk all the time. So to get a license for a PTA to become a licensed practitioner, there's two ways to do it. One, license by examination. That's the most common route. First, to do that, you have to graduate from a CAPT accredited college. Remember, CAPT is that arm in the APTA that oversees education of all PTs and PTAs. Then you have to take and pass your licensure exam. The licensure exam is 180 questions. You have 1 hour chunks of time to do it. So it's a 5 hour test and it's a long day. You also have to be in good moral standing. That means you have to pass a background check. And then, of course, because it's state run, you got to pay an application fee and they take your money. You could also do licensure by endorsement. That means you have an active license somewhere else, but you're going to go practice in another state. So for a little while, I was getting some business in Massachusetts. I had my active Rhode Island license, so I just had to contact Massachusetts Department of Health and said, I've got my active license. I'd like to be licensed in Mass too. I said, great. Now each state has a slightly different requirements for licensure by endorsement. It typically includes send us copies of your transcripts that you graduated college, send us a copy of your active license, send us a copy of your background check. And then a lot of states require that you pass a state practice act exam, also called jurisprudence exams. That means when I practiced in Massachusetts, I had to take, I think it was a 20-question test. In Massachusetts, can physical therapists do this? In Massachusetts, can physical therapists do this? In Massachusetts, physical therapists must supervise PTAs by this standard. And, I just 20 questions on just their state practice act. Do you know if in your teaching license you have a similar thing for?
Reciprocity, we talked about.
Yeah. You'd have to go to a similar thing. Yeah. So anyway. Really, really good. This is really important for anybody interested in travel PTA work. Travel PTA work, typically you get contracts for 13 weeks at a time, all over the country. The most often need is when PTs and PTAs who become mothers take a maternity leave, and it's like, hey, we don't want to hire somebody new. We just need somebody for 3 months while this person's out. Yeah, you get to swoop in, work for a few months, and then you leave. Pretty cool. Pretty great way to see the country, and you get paid. And travel, all of travel healthcare gets paid well. So it's a really high paying, but you have to apply for your license in each state. That can be really time consuming. There's a way that we're doing a better job with that. I'll talk about that in a few weeks. But so the Board of PT Examiners is within the Department of Health and has 4 major roles: proposed regulations that impact PTs, approve students to sit for the licensure exam, grade licensures to PTs and PTAs, and then handle complaints against PTs and PTAs. The misconduct complaints can result in reprimand, prohibition of license, as well as suspension. Reprimand is basically a public acknowledgement saying you shouldn't have done this. Prohibition is you can still work, but you have these other stipulations behind you. Most of the time, it means your notes have to be co-signed by someone else. The one that I'm most familiar with is a guy was fraudulently billing. So he was saying his patients were there for 60 minutes, but they were only there for 40. So his prohibition is his notes need to be signed by someone else. So now it's on the other person to say, was they here for 40 minutes? Because you said they were here for 40 minutes. Now, so or you could suspend the license, which means you cannot work at all. So there's a bunch of different variations of prohibition. Now, the complaints can be ethical, not just legal. We'll look at that in a little bit, but let me pull something up. Here's the Department of Health website, and you can find any disciplinary action. One PTA, handful of PT. So this is all of the Department of Health reprimands or suspensions all the way back from 2018. So handful of years ago. Still one. This is the one. This guy was working at a nursing home. Blood alcohol content 0.24. Anybody know what the legal limit to drive in Rhode Island is? 0.08. This person was 3 times the legal limit working with patients in physical therapy. Who's holding up who? What kind of patients are in nursing homes? Older, fall risk.
They always
Here, walk like this. Like what are you doing? Anyway.
always have an extra nurse though.
Well, there's a lot of staff. The staff was eventually said, "What the hell is happening here?" And yeah, we don't want this person working. So let's see. There's some others here. Let's see. Oh, graduate CCRI. Uh-oh. Touched her breast in an unprofessional manner. Yeah. What? All right, listen. This isn't funny, but I can't think of touching a breast in a professional manner. What does that mean? Like, no, excuse me, I'm going to be very professional as I. Come on. Yeah, so that's no good. So actually, let's see, there was another one. Well, we can go back to that one, touch your breast. So depending on the details, like what police officers would also tell us is there might not be enough evidence to charge the guy for, right? And guess what? In the physical therapy world, we come in close contact with our patients. We do. I listen to their lungs, areas of the chest, right? I help the patient stand up, and when they do that, man, I put my hands right on them because I need to help them right up the stairs. So there are ways I get into very close contact with our patients. So there might not be enough evidence to charge that guy criminally, but luckily for us, complaints can be ethical violations, not just legal. Like we have a lot more wiggle room. The Department of Health has more wiggle room in that, and that is a very good thing. So we will dive into these in later weeks. Right now, we just need to know they exist and some of the titles for them. So the legal and ethical guidelines, one, laws, federal laws and state practice act, but also the APTA defines what best practice is. The three major papers for us to know: value-based papers for the PTA, standards of ethical conduct for the PTA, and guide of conduct for the PTA. There are PT versions. It's the same titles except for the PT on all of those. We'll look at those later. You can glance at those. I will never expect you to understand or remember every single item. I think each of these are about 4 pages long, something like that. I will never ask that you know everything in it. When we dive into it later in later weeks, we'll see there's a lot of overarching trends. The trends are treat your patients well, act in a morally ground way, put your best interest of the patients above your own. Um, Make sure that you have the skills, you have continued education, continued skills, you continue to grow and show as a clinician you're keeping up with it. So a lot of them that you're gonna when we read that, you go, yeah, isn't that what everybody just does all the time? So but we'll dive into them later. For now, you just need to know the titles of them. Professional designations are important. Professional designations the reason why they're so important is because it basically tells us the scope of practice. So in our documentation, when I write up all of the stuff I do with my patient, I write DPT. Everything I talk about better be within my scope of practice. And if that baseball player with the ankle sprain comes in and you say, looked at it, put some ice on it, talk to the PT later, PTA, you just documented that you treated something that's outside of your scope of practice because you have that been evaluated yet. So it's important for that. So common designations, one, just PT, capital PT stands for physical therapist. Lowercase PT, if they're both lowercase, you guys know what that abbreviation is? Patient, good. MSPT is Master of Science, DPT, Doctor of Physical Therapy, PTA, Physical Therapy Assistant, student SPT, Student Physical Therapist, and SPTA, Student Physical Therapist Assistant. So those are all very important to know. What was? I'll come back. Did I skip this collaboration with AIDS? Oh, I apologize. Let's go back. That's important. That's what I was looking for there. All right, so we did talk about PTAs with general supervision available via telecommunication. With text, collaboration with text. Text, this is the definition of what a tech can perform. Non-skilled aspects of care. And each state defines exactly what non-skilled aspects of care. Some states, all they can do is fold laundry and clean tables. Sweep the entranceway. You can walk Mrs. Betty in from her car and from the parking lot into the clinic, but once they're in here, you can't do any patient. You can make copies of exercises, give them pictures, grab a glass of water if they say they're thirsty, but you can't do any other aspects of care. In Rhode Island, non-skilled aspects of care also include demonstration of exercise, counting of reps for that person, collecting, oh, you need the 3 pound weight for the next, I'll go get the 3 pound weight for you. So in Rhode Island, we get to be a lot more, techs get to be a lot more interactive with the patients. Some states, it's, you can't do anything. Your job is to wash that table when we're done with it. I don't want to get too much on a soapbox. We'll skip that. It's gonna be bitching about that for now. Regardless of the task, a technician has to be supervised with direct supervision. That means they have to be in line of sight of who is supervising. So that means if a tech is working with my patient, I can't go, hey, my lunch is ready. I'm going to go grab it. I'll be down. I'll be right back. Nope, because now I'm no longer in line of sight. I can't have, hey, your 11 o'clock evaluation got in at 10:30. Can you see them? Yeah, the tech will work with them while I go evaluate. Nope, because now I'm no longer in line of sight if I'm at a different room. So line of sight, that's what direct supervision is. Students, both PTs and PTAs, also require direct supervision, but student PTs and PTAs can provide supervision of techs. At one point, a couple of semesters ago, I had a student write a nice chart of this. I'm not going to do it justice, but you know, PT, PTA, general. X, direct. And then it was like, something along those lines. Like they made a really nice chart. I butchered it, but something along those lines. PTA, SPC. Something along that line. I don't know. You guys figure it out. Anyway, so yeah, direct supervision. So make sure that you understand general versus direct supervision. All right, so where were we? All right, negligence and malpractice. So negligence and malpractice, negligence is failure to act as a reasonably prudent person would. Must have four different elements. The therapist owned a legal right of duty of care. So the patient therapist relationship exists. If somebody falls in the parking lot, CCRI, I am not their physical therapist. I can just walk right past them. It does not matter. One of my patients, if I'm walking them to their car to practice, can we make it to the car safely and they fall down? I can't say, got to do something. Right? Therapist failed to provide appropriate standard of care. We'll talk about that in a little bit. Patients sustained injuries or damages, and they were directly caused by failure to provide appropriate standard of care. Sometimes we're doing something that's at risk. We're taking patients who are sick and or injured and having them do things to try to get them moving better. My patient that fell and broke her leg, guess what? She's at risk of a fall when I'm with her. I'm doing something dangerous. Sometimes bad things can happen. But if we do all the right things, we're kind of off the hook. So, I've got a couple of examples for you. I have a friend, he does some legal work. He's a legal consultant, expert witness, that's what they call that. So he gets to read these cases. He shared one with the horror story. PTA was working in a skilled nursing facility. The patient had a knee replacement. Therapist got the patient from their room, put them in a wheelchair to wheel them down the hall to the PT gym. The wheelchair did not have footrests on it. So the patient had to hold their leg up as they're being wheeled around. Now, what do you think happened? They got tired and hit the ground. The case said the therapist became distracted. My guess is it was something work related. I bet someone came up and said, "Hey, Nancy, room 308 wants you to go after lunch instead of before. Is that okay?" I bet you it was a work related and not playing with their phone. That's what I'm guessing. But anyway, she got distracted. Patient got fatigued, touched the ground. Therapist wasn't watching, rolled over the patient. Leg bent underneath, patient fell on the ground. They get the patient up. They notice that the knee replacement is now bleeding. They bring back to the room, grab some ice and some water, and say, "I'll see you this afternoon." Or I'll see you tomorrow, maybe. All right. Oh, also, when that incision opened back up, it got infected and she died 2 weeks later. All right, let's go through the list. Therapist owned legal duty of care, yes. Therapist failed to provide appropriate standard of care at time of injury. All right, so again, mistakes can happen, but if we do the right things, then maybe we can get by. What would you guys have done? Your patient had a surgery, now it's bleeding. Call the surgeon. That's a great answer right there. Any others? So maybe provide some first aid, and we have to be careful. Like if it's an emergent situation, yes, we provide first aid. Yeah, maybe. Any others? Nurse at the nursing home. There's a nurse. Yep. Any others? There's one other good answer. There you go. There's always there's a PT available via what? Telecommunication, via phone. Yes. So any of those, you guys are 3-ish hours into your education as PTA. You came up with 5 great answers, better than what that PTA did. After 3 hours of education. Good, that's pretty good. I've only had, I shouldn't say only, this is terrible. I've had 2 patients fall while I've been working with them. 15-year career, 2 patients. One of them, the automatic door openers? One of them, this guy's apartment building, it always broke. The gear would always fall down. All you had to do was push it back up and it would work again. The building replaced that mechanism the day before my last visit. Now, last visit, here's my discharge evaluation. You got to show me you can walk to the car by yourself. He had above the knee amputation, learned how to walk with his prosthetic. All he has to do is walk to the car by himself so he can go to the doctor's office, right? If he can't do that, I can't discharge him yet. We're not done yet. So I'm standing back, and I know he's going to do great because they did not time the door shutting mechanism when they replaced it. So he pressed it, it opened up. He gets halfway through and it slams on him. It doesn't shut slowly and it doesn't stay open long enough. It slams on him and he falls down. That was the first time a patient's ever fell on mine. No injuries. What the hey, get me up. Pick him right up. He goes, all right, let's go. And he walks the rest of the way and I go, don't count that. I'm done today. All right, man. Called the doc, said, hey, just let you know he fell. There's no injury. He's 100% fine, but I want to let you know, right? So there we go. Something bad happened to him. He might have a bruise, but he might have an injury. But appropriate standard of care, and was it because of my failure? Oh, you want to know the other time the patient fell? This one's awful. So I walk in, first visit. First visit, I got a lot of paperwork to do. So I say, where's a comfortable place we can sit down? Oh, kitchen chair. Oh, we'll go to the kitchen chair. So we're sitting at the kitchen table. The lady's about 400 pounds. We're sitting, I'm doing a bunch of paper. I hear creak. What the heck was that? It's the paper. Boom, the chair breaks out from underneath of her. The front legs broke. The back of the chair flipped into her. So when she came down, it clipped the back of her head. She's on blood thinners. Her head swells up immediately. What the just happened here? Like, I had to call 911. She's got a huge, like, blood thinner head. Like, this is a major problem. Is any of that my fault? No, but guess what? If I said, I got to get out of here, if I didn't call 911, now I am on them. So sometimes bad things can happen to our patients, but as long as we don't have all 4 of these elements. So prevention of malpractice lawsuits. Again, I've been working for 15 years. I can't tell you how many hundreds of, we could try to calculate it, but it's been thousands upon thousands of visits I've had. Those are the 2 in my career. I don't think either one's my fault. Probably should have been a little bit closer to that guy. I still think I don't know. What do you guys think? Was that? I should have been a little bit closer though, no? It's a regret. I wish I was closer. I wish the door shut on me and we didn't fall. We ended up fine. The other one's not on me. So how do we prevent it? Continued education is the big thing. Make sure we're at the best standard, up-to-date research. Make sure we have competence. We'll talk more and more next week about education and continuing education. Practice within your scope of practice and be safe. Being safe is something that we talk about all the time. So much more important to be safe than be aggressive. It's always err on the side of safety. And then document thoroughly. Document thoroughly. That horror story of in the nursing home, that therapist documentation was suspect at that. So yeah, we've got to document everything in our notes. We'll talk more about documentation in future weeks. All right, so some abbreviations. Let's flip back. All right. That first one, here, legal standards include federal. We talk about that a lot and lot and lot. Staying within scope of practice. I'm going to skip that one for now. You can spend a little bit more time on that. Differences between practice of PT, PTA, and aid from a legal perspective. So there were basically PTs can do something, PTAs can do something, and PTAs aid or techs cannot do something. So PTs, legally speaking, can perform what? Evaluations. Great job. PTA versus aid. I think the easier one is the PT aids techs can only do what? Those like that's an example, and there's what's a better like 3-word phrase to kind of give an all-encompassing non-skilled aspects of care. That's what we should. And then PTAs are the skilled practitioners that can perform the interventions, not evaluations. What are the four things the Board of PT examiners do? Propose regulations. That's number one. You know that rule about every 14 days there has to be a supervisory visit for PTAs in Rhode Island? I have a friend, he lives in Louisiana. He does home care as well. His territory is a 3-hour drive territory. Anywhere within 3-hour drive is what his territory is. It is unrealistic in different parts of the country. Rhode Island, we can't get away, although Little Compton's getting close. But Rhode Island, we don't have that problem. The Board of PT examiners in those rural areas say in the home care setting, it is unrealistic to have PTAs require in-person supervision every 2 weeks. It is logistically cannot happen. So our Board of PT examiners are going to propose that the supervisory visits can now be done via telehealth or, just phone call or every month instead of every 14 days. Like that's what the Board of PT examiners gets to do is look at, okay, this rule is important, but maybe for this setting in this physical therapy world, it's not. Does that make sense? So that's what we mean by proposed regulations. Good. 3 others functions. Approve students to sit for the licensure exam. 2 more. Handle complaints. Yeah, we saw that. That's the other one. And then grant licenses was the last one. How do we achieve licensure? 2 different ways. Take the test. So licensure by examination, few different criteria for that, and then endorsement. So that means you already have an active license. You're just coming to town. You got to jump through hoops, but get there. So look at the specifics on that. Professional designations and what each one is applicable for. So what were they? PTs, just physical therapists. MSPT Masters of Physical Therapists. DPT, doctor. SPT is student physical therapist. SPTA, student physical therapist assistant. One other. Yeah, we got that one. Just PTA, I think. I didn't hear. Maybe you guys said it, but I didn't hear. So just physical therapist assistant. Yeah. Disciplinary actions. 3 different levels of disciplinary actions. Suspension is one of them, most severe. Suspension and revoke are the same. It's just we're suspending your license forever. Like it's yeah, so it's just suspension. What was the other one?
Probation.
Probation. So you can still work, but we're gonna make you either get your notes co-signed. I saw one, that guy that touched the person, he might need a chaperone anytime he has female patients, which means a chaperone is a secondary would be the third person to just be a witness. There could be all sorts of different probations. And then one other one, reprimand. Don't do that, right? Supervision of SPTA and PTA. I should also put text in here. So add that in on your own. But supervision of the PTA requires what? General supervision. And tell me what general means. PT is accessible via telecommunications, telephone at any time. SPTA requires what? Direct supervision. So that's where, yeah, got to be like in line of sight. Exactly. Yep. How about text? Yeah, line of sight, direct supervision. Good. Couple of strategies to avoid malpractice. Continue education, continue to grow as a clinician. Yep. Document thoroughly. Yep. There's one other one, I forget. Was it? I mean, it sounds like it should be. Oh, practice safely within scope of practice. Yeah, it's basically competent, right? I will say we don't get sued a lot. One, because we practice safely within a scope of practice. Two, I mean, we develop good relationship with our patients. They know we're working hard for them. So, all right. Any questions on anything we covered today? So at some point, I think tonight, I think on your ride home, review. Whether that's quick, like on the ride home, or you make it a little bit more structured by rewriting your notes either tonight or tomorrow morning. Preview before class and schedule your study time for this class, but all of your classes, okay? All right, anything else? It's a pleasure. Thank you guys so much for your energy and your participation. I really appreciate it. Thank you. Get to studying.